Hi, Jason Pilgrim here from the Profitable Practice podcast, where we help allied health professionals just like you empower and inspire the lives of so many more people by building bigger and better businesses. Let's go and get stuck in right now. G'day guys, welcome to another podcast for the Profitable Practice. I'm here down south, about 4.5 hours south of Sydney with the founder of Eurobadella Health and Fitness, and Hamish, mate, thanks for joining us.
Thanks for having us. Thanks for coming down.
Pleasure, mate, pleasure. Bit of a quick little random setup here, and we started talking about, I guess, the medical sick model, let's call it that. Medical sick model, people sick, go to the doctor. The proactive gym, exercise, healthy lifestyle, and they're almost at two different ends of the spectrum. And I said, hey, let's talk about this because there's some really good stuff that you guys are doing that can be a benefit to a lot of people in the industry and a lot of health professionals. So let's chat about it for 10 minutes. Give some pearls of wisdom, tell them what you're doing, what we're doing, how we're making it work, and how we feel we can get this across to more people and put some benefit forward. So
awesome.
We're not actually doing a 5 do's, 5 don'ts. We're not actually saying here are the top 5 or top 3 or whatever. But there's some real gold nuggets that I know that Hamish started to talk about. And I said, no, stop. I actually said, shut up, stop. Let's cut this right now. So, mate, let's get stuck in. Give me a bit of background, set the frame, and let's go from there.
So I guess what we do is we run a health clinic and a gym together in one. We also have EPs that go out and work out of some of the medical centres. And so I guess to summarise it in one sentence, what we're trying to do is we're trying to bridge the gap between the healthcare clinic model,
the SIG model,
and the gym model.
Yeah.
And I know that there's a lot of kind of bullshit in our industry about personal trainers and exercise physiologists and physiotherapists and so much of a kind of animosity sometimes between the different professions.
Yeah.
And I see so much value in us actually just working together. And as exercise physiologists, what that means is that we can kind of put one foot in that healthcare camp and we can talk the talk with the doctors and with the physios and that kind of stuff. But we can also get out on the gym floor and work with the personal trainers and have a good relationship there and really kind of bridge that gap, open those communication channels that are going to help people that they may have been in the gym, they may have been exercising and then they get sick and something goes wrong, but they want to kind of get back there again. They know where they've been, but they get lost in that system. And so I think that as exercise physiologists, we're in such a unique place to kind of bridge those two worlds.
Yeah.
That it's an awesome opportunity that I'm loving, and I'm loving the way that we can kind of work with those other healthcare professionals.
Okay. Let me jump in there for a second. So just to frame this up for those of you playing along at home, Hamish is an exercise physiologist, but you do have EPs, you do have personal trainers, You've got exercise scientists. You've chosen not to bring physios into the mold because of the town, and you have physios and massage therapists down the road, and you guys have Massage U too, by the way. But you guys have a very, very strong collaborative relationship where they actually work with you guys. So all the EP stuff comes across to you guys and do that, and you actually have all the physio stuff going back to them. So, and because this model, there's 2 other clients that I have in the tribe, and you probably know who I'm talking about as well, that, excuse me, that have a very similar model to this, but they have physios and EPs, and one of them has a dietitian in that as well. So I can work in that refrain as well. It's not just saying this is this podcast is for EPs only, because it's not. It's for physios and dietitians and all sorts of PTs and that type of stuff. But it's actually probably understanding that there's no actual perfect way around this. You can actually work with different models.
Yeah.
Like we could choose to burn that professional bridge and bring in physios and that type of stuff here, which you haven't and you're not. But we could do that as well with more disciplines as well.
I think it's just about opening up that communication and doing that in a positive way with other professions. And like for us with that mob down, with the other mob down the road in town, it's making sure
the mob.
Yeah.
I'll make sure I send this podcast to them. The mob.
Country speak. that you create those good professional relationships, and that's, I guess, the crux of it.
Yeah.
And I think a lot of people do that really well. But it's
sorry, you're right.
But it's been really good for us having kind of being in both the healthcare model but also that fitness model, and having our own place here that kind of bridges that gap has been it's been awesome.
And what I was going to say is I always talk about, I'm sure I've done a podcast on it before as well, I always talk about co-opetition. I think that there's too much bullshit about, and angst and animosity between physios and chiros, or physios, EPs, personal trainers, blah, blah, whether you're Cert 3, Cert 4, there's a whole lot of stuff there, right? And also, the guys down the road, not your guys down the road, but, they're the competition type thing. And I always say, no, it's bullshit. Let's not be about competition. We actually need to cooperate with the competition, because your example is exactly right. We could easily turn around and go from a business model. We could bring in physios and do this and do that as part of who we are. But if we look at it holistically, as we already are doing that anyway, they're just in a different business under a different business name, a kilometre down the road, then it's still actually achieving the same outcomes for the clients. It's actually achieving better longevity for the industry, for everyone in the pie, etc. And I think at the end of the day, we have to bring it back to client outcomes, what they are wanting or what they're needing, not just superficially looking at growing a business for financial gain.
Well, and there's so many people that need help. There's no shortage of that.
Oh, absolutely.
There's always going to be people out there that need your help. So
I used to have people think it was really funny when I said, try and make myself redundant. And they're like, but you can't, because you wouldn't have a business. And I'm like, no, the more you try and make yourself redundant, the more people come back for other ailments, and people are always going to come back and see the physio because they've now got a wry neck from the dodgy pillow, or they've lifted the wrong way at work, or they're always, they've rolled their ankle, an avulsion fracture in my ankle at the moment from stupidity. And it didn't involve alcohol before you asked, by the way. But yeah, you're in that type of situation, you're never going to be redundant. We're going to have ridiculous amounts of the chronic disease, the lifestyle intervention and things like that is only going to become more prevalent. So we're never going to run out of work, right?
Yeah. So we just need to work out how we help a bigger percentage of those people. And for us, actually that gym model where you can keep people healthy, they help them out, they've got a place where they can stay healthy, and when they need a little bit of help, it's an easy trip down the corridor to come back to you.
Yeah.
It's actually really cool. And it doesn't work for everyone, definitely.
Yeah.
But for those people that need a little bit of extra support and a little bit of extra help, it's really powerful.
So you'd probably find it pretty challenging seeing people work just out of a little room at a medical centre, pay their,
I've done it. I do it occasionally, and I hate it.
Pay their X amount for room rental and that, basically buying their referrals across, and get all their EPCs that need to be bulk billed and blah 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 and etc. You'd be pretty challenged with how much we can actually really help them a lot of the time in a small room with.
Yeah. So look, we do it. We still have medical centre where we're working really closely with them. The way I think about it though is that's your door into communication. That's our ability to do initial assessments and offer opportunities for people to come to our clinic and stuff as well. It's not where we try and do the majority of our work. I would hate to be stuck there every day of the week. Yeah. But what is really important is that you're in there with the medical centre, you're in there with their other allied health, with the psychologists, the physios, you're in there with the nursing, practice nurses, and you can have those conversations that drive patient outcomes.
Yeah.
And so I think if you remove yourself completely from that, you actually shut down a fair chunk of the communication channels unless you're very proactive about it. Now, definitely you can get around it, but by just being there for us, it's 1 day a week, then it allows me to keep those communication channels open. If you have someone you need to check up on, you can do that. If you need to organise a sit-down meeting with a GP about a client, with a client, you're there, you can do it.
Yeah.
And you don't have to kind of leave your practice to go do that all the time. So actually, I think it has its value, but it's about how, the mentality around that. And I wouldn't want to get stuck there every day.
Absolutely. I think the other really positive side when you look at the other end of it is we're trying to actually empower people, we're trying to inspire people, we're trying to get people to change their behavioural patterns, get more incidental exercise, eat healthy, all these different avenues. There might be different niches, for instance. It might be about getting rid of pain, getting increased range. I mean, you guys work with different athletes, and I saw one of the guys out here with all his Giants clothing on and that before, and doing all his sports science and plyometric jumps. And I'm like, with my ankle at the moment, I won't be doing that. And I think the avenue to be able to have a focus of making yourself redundant you know, and trying to get rid of, you know, so much more of that acute management of see you next week, can be in place, but you can also use this exact model to flip that on its head, because you are still trying to not see them, you know, over and over and over again, and you're trying to actually discharge them, but you're actually in an environment where you're providing a proactive, empowered environment where they're able to work in their new behavioural patterns. They're, you know, working and being more accountable to what they're doing and delivering in a socially acceptable environment where they're supported, where you guys are still here. And that might be off a bit of a membership type model. I know you guys have implemented that really well here, so that it's not a standard gym. They're not just doing 24/7, oh, it's a gym, oh yeah, it's Hamish guys talking about a gym. It's like, it's not, it's a different environment where they've always got their therapists around.
Yeah, and I guess like a good way to think about that is like, whilst we were doing our team development stuff earlier, we had someone come in to work on their athlete development.
Yep.
A guy with a brain injury come in with his carer and go through their program, and a lady who's doing our osteoporosis bone strengthening program.
Yep.
And all three of them, whilst we're sitting down doing our team development, they came in, they've got their stuff they're working on, they give you a wave on the way through, and then
one of the guys jumped up for 2 of those 3, ducked out for 60 seconds to say g'day, a little bit of a personal touch point, helps with the business development, growth, etc.
But then they come in, they do their thing, and they're in a place where they're supported to do that. They're encouraged to learn, they're encouraged to ask questions, and it gets away from that kind of 24-hour model which has no one in there, no support with it. Yeah. And that's the beauty, because as therapists, you want to engage with people, you want to help them.
Yeah.
And
I also think about it as well, if we move that further down, if, you don't ever wish ill on anyone, but reality is those 3 people will roll their ankle, or they'll have a car accident, or they'll wake up with bad headaches, and they're going to need treatment, or they're going to need help with a program, or they're going to need rehab, or whatever it happens to be. Then you guys are perfectly placed, because you're the ones that are the authority. You're already there with the right experience and the right relationship. They're perceived to be your friends. We know that friends buy from friends. They already know you, they already like you, they trust you, they've already bought from you. Yeah. It's a really good model to be able to work on that approach. And just quickly as well, you touched on stuff before about at the very start about the bullshit that we, and there's a lot of bullshit in the industry at times about from so many different reasons. Let's just keep this really narrow focus here, Chasey. Otherwise this 10 minutes turns into 3 hours 10. I think we need to be really mindful of the fact that it is around co-opetition. And I think it also means that we have to always make sure that we park our egos at the door. Yeah. I mean, there's nothing more frustrating than reading something about, the chiro with a 4-day-old baby, whatever, doing manipulation of the neck of a 6-day-old baby and stuff like that. And that's not a slander of chiros at all. That's just me saying we hear something like that and everyone gets out the pitchforks and everyone turns around and goes, and everyone wants to have a dig. And I think we all need to keep in mind in this scenario, there's a great way for us to all collaboratively work together, right? Yeah,
and I think that no one's the keeper of all knowledge.
No,
and
absolutely.
There's also so many different situations where you try to help someone and someone else has succeeded later down the track, or vice versa. So it's just, again, a case of that if we work together and you provide those different methods for clients and patients to engage with healthcare professionals and with the healthcare system, they can only drive better outcomes.
Absolutely.
And the more that we add bullshit into the industry, the more it kind of confuses people, the more it destroys reputations. And so from my perspective, and especially in kind of regional and remote areas, then you need to work together.
Oh, absolutely. Well, you can kill the pie real quick, right? We're all and I always think about this at different times. Like, actually, we were in conference a couple of weeks ago, and I remember making a distinct comment in regards to one avenue, and it was like, whatever you do this, one of the biggest things that we're not thinking about the net result is you're actually going to destroy the rest of the pie for everyone else as well. So it's not just a negative on you as a practitioner or your business or your team or your town, but it creates a negative connotation for the whole industry as well. And so you have to be very careful about that. Yeah. Whereas, we've had clients down in Melbourne, and I use this example because I think it's fantastic, and they both, with the same industry inside allied health, both young, vibrant clinics moving forward, and they were on the same road, 800 metres apart. And everyone was like, hang on, but why? No, it's competition and blah, blah, blah. And we completely changed that mentality and went, no. And within a probably 2 month or 3 month period, we actually had each person actually cross-referring to each other on like same town, same road, 800 meters apart, same, you know, specific, you know, they're both physios or EPs or dietitians, right? I'm not going to, you know, you probably know who I'm talking about, but I don't want to use names in the podcast. And they actually started referring, looking at who their niches were, who they wanted to work with, who they didn't want to work with, who their team was best to work with and not work with, which is, you touched on that before. And all of a sudden these referrals started flowing. So by actually growing the pie and working collaboratively with the other person down the road, they're actually growing their own business as well.
Yeah, and I think it all starts with you as well. If you're not prepared to kind of send that referral through and ask for help, then you can't expect someone else to either.
Yeah,
so
you really got to park your ego, swallow your pride.
And we're pretty quick as allied health professionals to ask other people for referrals.
Yeah, absolutely, and that's gold. I love that. It's like, you know, why, and I have it all the time. Like, you think about like my position in this is, you know, people go, oh, what do you need? What do you need most of all right now? And everyone goes, I need more leads. I need the doctor to send me more referrals. And you go, hang on a sec. Like, we always want to put our own hands out. Absolutely, and I think that's a really gold nugget on that one. So, mate, all right, let's park it right now and go and get some more work done with the team. But mate, thanks again for jumping on. Really appreciate your time.
Thank you very much.
Mate. Thanks, guys. It's another episode of the Profitable Practice Podcast. Look forward to talking with you again soon. Cheers for now. Hey, guys. Thank you very much for listening to another episode of the Profitable Practice Podcast. I would love nothing more than for you to be able to leave a review. I get so much joy out of listening and reading the amazing things that you guys say about this. So please subscribe to our channel, leave a review, and share it with your friends. Let's get some more fantastic information out there so all of us can grow the industry together. Cheers for now.